So hi everyone, my name's Rachel Hill. In the 2 years prior to joining the Public Health Graduate Scheme, I worked at Hertfordshire County Council in 2 different roles within adult care services. The first role was in the community finance team, where I would carry out residential and non-residential financial assessments for service users that were receiving care. And then the second was as a link accountant, where I would support budget managers with their budgets and reconcile grants. I think it's important that you know that I have done other jobs, such as bar work, waitressing, working in retail, so don't be put off if that's all the experience that you have. You pick up and develop skills in any work setting, whether it's an apprenticeship, Saturday job, or working in retail. I would focus on the skills that you have learned and develop and plug these in your application. So my graduate role was labelled connectivity and involved working within the adults and older people team. I initially supported the Stop Smoking service, but then as working from home kicked in, we were put into different coronavirus teams, cells, and I was in the wellbeing cell. The wellbeing cell was great. We would have daily check-ins and produce really interesting pieces of work. I wouldn't have thought of, when applying for the role, the kind of work that we'd be doing would be involved, but it was great. We did things like the wellbeing videos for YouTube and webinars aimed at professionals in the community. We were working with people we don't normally work with and developing ideas through discussion and pooling our knowledge and resources together. We're now back to doing business as usual work and are deployed into the health protection team 7 days a month. This involves doing the logistical tasks around contact tracing and can be a nice way to again work with members of the public health team that you don't usually. To be honest, I thought I was the most organised person in the world. I utilised Outlook, had my own personal Gmail calendar, had one with my family and friends, had a diary, used Headspace, Calm, podcasts, candles, baths, everything. And I could plan my time and just knew how to switch off, shut down, unwind. And then during the pandemic, these tools just stopped working for me. Working from home has been, I would say, the hardest thing for me. Knowing when to switch off and shut down can be hard when your work is only 10 steps away from your bed. I'm still in the process of adapting as the working from home environment is constantly changing. On a Friday, sometimes I just have to force myself to get in the car, go to McDonald's, listen to the radio really loud just to break up the bit between work and relaxing. So despite working from home, the public health team do try and ensure that you get a little bit of the office environment. Things like having the online kitchen and social quizzes every couple of months gives the opportunity to know people outside of your closer working team. This year has given me the opportunity to develop my skill sets, try something new. We're all trying something new working from home, and also the opportunity to create new and build on existing relationships, some with colleagues you haven't even met in person, and then also the opportunity to progress within the public health team. So I would say this year has also reminded me of why I'm passionate about working within the local authority. Working within a local authority, you're given the opportunity to work at a local level while having an impact on a national scale. Working within the public health team, you're not just one sole functioning body. The team's associated with a multitude of organisations and works in partnership with a variety of other stakeholders. The work we produce aims to make a difference to not just Birmingham, but the people of Birmingham. So if you're successful in getting an interview, prepare, but try not to be overly forced. I think your natural passion and desire will show when you speak. Even though you're not meeting the interviewers in person, not shaking their hands, etc., try and make up for it, I would say, with eye contact, taking pauses, thinking about the questions, thinking before you speak, and also make sure, like any other interview, try and have a quiet room, okay Wi-Fi signal, turn off your phone. And another thing I would say is with the application, please read the job and personal specification and try and answer every bullet point. Good luck.